I was diagnosed right before my 74th birthday with stage 2 IDC breast cancer. And it's been 8 months now that I have been going on a healing journey to try and restore my health without medical intervention, without conventional medical intervention. So I have had no surgery, no chemo, no radiation, no hormones. I have been doing the Dr. Schultz detoxes and cleanses. I feel great. I have an appointment with my doctor on October 30th and another ultrasound on October 24th. So today I want to talk a little bit about finding an integrative oncologist and how critical it is if you're going to do alternative treatment or no treatment, if you're going to handle restoring health with lifestyle and dietary changes, then you're either going to have to go it alone, in the sense of you're not going to be able to find a conventional doctor that will support this, or if you're really, really lucky, you can find an integrative oncologist. And then you can still do all of the things that you want to do, lifestyle, dietary, exercise, emotional cleansing, all of that stuff. But at the same time, have a medical doctor who can support you and be a partner in your journey. And so I want to talk about that today, because finding an integrative oncologist and finding support within the medical community is both incredibly important and incredibly difficult. So I want to talk a little bit about my journey with the medical establishment, and also what I've learned in the last 8 months. I was actually diagnosed February 14th with stage 2 breast cancer, but the lump actually had emerged on December, right before the holidays in December. And so I knew that there was something wrong, but until I actually got the biopsy in February and the diagnosis, I had thought that I had just gone off my previously healthy program, and that possibly this lump that had appeared really fast and really large might just turn out to be a fatty tumor. So I want to talk a little bit about my journey with the medical establishment and how to find an integrative oncologist, or not how to find, because that'll be a journey everybody has to do on their own, but how critical and important and helpful it is to find an integrative medical doctor. So I had been going to my regular doctor, my primary care physician. I actually went to see her the day after, I called her the day after the lump emerged, and I got an appointment, but it was 2 weeks before I went to see her, and I immediately started doing lifestyle changes, because I knew that I had gone off the rails in terms of my health in the last 3 years. And I don't need to go into my story of the last 3 years right now, but it involved, grief at the loss of my other half, having to sell my house and move, getting involved with a company that turned out to be not what it said it was, exhaustion, moving, grief, all of those things. And though I had still kept up a few healthy habits, I was still doing my superfood, the Dr. Schultz superfood every morning, everything else in my life kind of fell apart. So when the lump showed up, of course, the first thing I did was go see my regular primary care physician. And I explained to her that I felt I had gone off the rails in terms of diet right before the holidays. I was eating cheese, which was not good for me. I was eating pastas, and I spent a lot of time hunched over my computer. I just wasn't living the healthy life that I had tried to create before. And my energy level was just, I just done. I had no interest in doing anything. All of the things that I had wanted to do when I moved, I had sold my 5-acre property, bought a boat, a sailboat, and had meant to start working on a creative project, writing or film project, and instead had gotten completely derailed by working for a company that turned out to be basically a real estate investment scam. But when the lump first emerged, I went to see my primary care physician, and I explained that I thought I had just, gone off the rails, and that if I could just have a couple of weeks of doing healthy cleanses and stuff like that, that I would be, back on track. But it was kind of scary because the lump was really big, and it was literally throbbing. It was so large that I could feel it with my arm as I walked, and my arm would touch the side of my body, and it was scary, but I still sort of held hope that it was just a fatty tumor, and some minor lifestyle changes would take care of it. And originally my primary care physician was actually pretty supportive. She supported eating healthy. She supported all the dietary things. But when the biopsy results came back and showed the stage 2 cancer, and I hadn't yet started doing all of the detoxes because I didn't realize that the issue was as systemic as it was, she got very insistent that I had to go and immediately see an oncologist. And I appreciated that, but I also, because of my experience with friends and family and others who have had cancer, I was pretty sure I knew what an oncologist would recommend, and that it was going to be either surgery and or radiation, chemotherapy, hormone replacement, or something of that ilk. And I knew that although I would certainly consider surgery and some sort of medical intervention as a last resort, that my first resort was going to be dietary and lifestyle changes. And because I was pretty adamant about that, I started having really difficult problems with my primary care physician. And I don't want to go too much into detail about that, and I know that her intentions were good, but basically what happened was I asked her if she would help me find an integrative oncologist, and she said that she would, but then she sort of forgot that she had said that. And so I immediately started changing my diet and lifestyle. I started doing the Dr. Schultz 30-day cleanses, the detoxes, the bowel cleanse, the kidney cleanse, the liver cleanse. And my breast, which had been obviously inflamed, went through all sorts of extraordinary changes with the detox. And so I started to feel some confidence that I knew why I had gotten sick, and I thought I could regain my health, and always keeping in the background the fact that diet, if diet and lifestyle and other changes weren't enough, that I would consider surgery. And my mother had breast cancer way back in the 70s, and they did a mastectomy, even though now they would probably just have done a lumpectomy or nothing at all. So I was pretty knowledgeable about what process is generally offered. So as I started doing these cleanses and I started seeing my breast lump respond, I got really excited about trying this. And when I went back to see my primary care physician after having done what I thought had shown some progress, I was absolutely stunned and shocked when, instead of examining my breast and saying, yes, I can see that the lump has changed, and yes, you still have to go see an oncologist, but I can see that some of the things that you're doing may be helpful, and I'll help you find an integrative oncologist. Instead, my primary care physician started screaming at me that if I didn't immediately go and have treatment, I was going to die. I was going to have my breast cancer was going to become brain cancer. I really, frankly, don't even remember all the things she said, but it was incredibly, I had walked in, and when I first walked in, I was in kind of this state of grace that I was so appreciative that my body had started making all of these, had already started to respond to the changes I'd made. And yet when I went in to my primary care doctor, she wasn't interested. She didn't care. It was like, you still have a lump in your breast, and if you don't do something immediately with treatment, that you could get brain cancer and all of these things. And so I did call the oncologist that she had recommended, and after talking to their office, it was very clear to me that the only things that they considered were the regular protocols. It was going to be surgery, and then either radiation, chemotherapy, or hormones. And that at my age, at 74, I might certainly avoid chemo, but that surgery was given, and that probably, hormone, radiation, etc. And I felt this total panic, because I was like, I know that I may need medical intervention at some point, but I want to try doing everything I can first to get as healthy as possible, because I know why I've gotten sick. I know how I've let myself go. And so if I'm going to have surgery, which was kind of the thing that I had in the back of my mind as, okay, this is a last resort if I have to have surgery, if they have to take the breast, or, the lump I thought was so big that it was unlikely that they would be able to just do a lumpectomy. So I basically ran away from the doctors and spent the next couple of months just desperately doing everything I could on my own with the Dr. Schultz program, which, by the way, has done it's been incredibly successful for me. There are some things that I want to talk about on another video about, there are some things that my experience was a little bit different than some of the things in the books, mostly in the sense that it may take longer. When you read about all of these things working and stuff like that, we hope that it'll work immediately, and then, you'll just be back to health and the lump will be gone. And instead, I found out that yes, the program works, but it's not just a program that you can do and then go back to your regular life. This is a lifetime change. So the eating right, the drinking enough water, the getting the exercise, the doing the emotional cleansing, the cleaning out your life, the getting rid of news and social media and all of the stuff that just keeps you hunched over your computer, all of those things work, but they have to be, it's a lifetime commitment. So one of the things that I ran into was that I also had a lot of very loving, well-meaning friends and family who were incredibly concerned that I was not seeing a doctor for my after my diagnosis. I wasn't seeing my primary care physician anymore because I had run out of her office in tears, and I wasn't seeing the oncologist that had been recommended by the primary care physician because I was pretty clear that I would not try any of those treatments, conventional medical treatments, until I had done everything I could to see if I could get as healthy as possible. So I still had in my mind that, okay, I will consider surgery. I'm not saying I won't consider any conventional treatment, but first I want to get as healthy as possible so that if I do have surgery, I have the best chance possible of recovering. So one of the things that I had to deal with was very well-meaning friends and family who were really concerned, who wanted to talk to me about their concerns, who wanted to make sure that I understood what I was doing and that, I should at least go see the doctor and ask them what they would suggest. The problem was that the biggest fears that I had were more fears that I had about what the medical protocol was going to do to me than what the cancer was doing. I'm not quite saying that right, but it's like as soon as I started changing my diet and my lifestyle, my body started responding immediately. So yes, I knew I still had a lump and it was cancerous. I wasn't denying any of that. But I did feel that my body was capable of regaining health, and that I wanted to find a doctor, but I wanted to find a doctor who wouldn't just dismiss that. And there were, of course, alternative practitioners, acupuncturists and, other alternative practitioners who offered things that would be helpful. But, I was a little bit flying blind, and it was stressful. And it was stressful for me, and it was stressful for my family and for my friends who cared about me. But at the same time, I was definitely resisting going back to my primary care physician or the oncologist that had been recommended. And so at one point, I had a friend who had offered to help and who was pushing me to, you got to go see a doctor, even if you don't do what they say. But I was so terrified because I knew that I would feel a great deal of pressure if they said, you have to have surgery immediately, and we don't care what you've been doing with diet and lifestyle, you have to have surgery immediately. And so, kind of off the top of my head, I said to my friend, you know what? You want me to go see a doctor? If you can help me find an integrative oncologist, I will go see him or her. So let's talk a little bit about what does that mean? What is an integrative doctor, whether it's an integrative oncologist or an integrative primary care physician? What is an integrative oncologist, and how is he or she different from just a regular oncologist? So hopefully I'm going to do some interviews with my doctor at a later date. So I don't want to say more than my knowledge of this subject is. But an integrative oncologist is an oncologist who is maybe classically trained, he has all the medical degrees, he or she has all the medical degrees. They can do, they can refer you for surgery, they do the chemo or the radiation or all of those treatments. And in that sense, they're just like a conventional doctor. The difference is they also, unlike most medical practitioners, they have a understanding of and acceptance of the fact that things like diet, lifestyle, acupuncture, meditation, all of these so-called alternative treatments can also be very beneficial. And they're not easy to find because, unfortunately, traditional medical doctors, and you can talk to your doctor and see if this is what their experience is. Traditional medical doctors generally have no more than, if you talk to them, they'll say, we got 1 hour maybe in medical school talking about nutrition. Everything else is medicine, drugs. The drug companies are right there with, as soon as a student starts med school, you've got the drug companies giving them all this stuff. You have all of these drug company funded studies and research that talks about how wonderful all these drugs are. And interestingly, you don't find a lot of studies funded by, the people with the money to tell you what the concerns are about these incredibly strong medicines that they give you. So by the time a doctor gets out of medical school, they have had thousands of hours of medical training, but they have had no training whatsoever in diet, lifestyle, exercise, et cetera, et cetera. And they may say, oh yeah, diet and exercise, healthy lifestyle or whatever, but they have very little understanding of it and very little belief that it makes any difference. And in that regard, you go to the hospital and what do you get? Hospital food. You go and you've had surgery and they're giving you hamburgers or whatever. Now they may give a nod to, you should eat healthy, eat less of this, but it's a very rudimentary knowledge. So how do you find an integrative oncologist? And why did that make such a difference to me? I don't know how you found them. This one was found through the universe, the miracle of the universe, because honestly, my insurance plan, which is an Anthem Blue Cross, I called Anthem and talked to an incredibly nice lady who offered to help me, which, she was patient and kind and understanding and all of that. And when I said, I want a doctor, and nobody knows, by the way, if you talk to Anthem and you say, I want an integrative oncologist, they don't know what that means. Mostly, they don't know what that means. And the only reason I knew what that meant was that 40 years ago, I knew an integrative oncologist who had been a very traditionally trained oncologist, hematologist, immunologist at UCLA, and had been very traditionally trained where, you really don't interact with the patient and it's all just, the cancer in room whatever. And then he himself came down with cancer. And in his journey to heal himself, he became an integrative medical practitioner and then ultimately actually started just working with people in other ways. But anyway, so because I had been in one of his workshops back in the early 90s, I knew what that word was. I knew what an integrative oncologist meant. And I knew that it meant somebody who instead of looking at the patient as, okay, I'm the doctor, you're the patient, you don't know anything, I know everything, I'm going to tell you what to do, this is the protocol for, you know, um, with a traditional medical doctor, there's a protocol. It's based on, you're a 74-year-old woman of this, this, and this is our protocol. We start with this, you know, surgery, and then radiation, and then, you know, if you're not. For me, my age may have eliminated chemo, but I'm not really sure because I didn't really look into all of that. So there's not really a partnership. It's like the information is all going from them to you. They don't really care that, you know, you do yoga and you're meditating and you're eating right and you don't eat meat and you were healthy until all of these, you know, things happened. And so finding a doctor who looks at you more as, okay, we're partners in this journey, and here are all of the tools that we have. We have surgery, we have radiation, we have chemotherapy, we have hormone therapy, and we have complementary or alternative or non-traditional therapies, which include diet and lifestyle and, you know, acupuncture or Chinese medicine or, you know, I don't know, meditation, all of these things. And an integrative doctor will take the time to find out about you as an individual, what's your process, what are you looking to accomplish, what do we have to offer that can complement what you want. So for example, at my age, at 74, I said to my doctor, I said, for me, you know, I'm 74. Lifestyle is, you know, a quality of life is all right now. I mean, it's not, you know, can I live another 40 years? It's what is going to be the quality of the time that I have. And if whatever time I have, I want to be able to spend it doing all the things that I've said I want to accomplish in my life and that I haven't yet done. You know, I want to write the book, I want to, you know, see the sunsets, I want to go sailing, I now live on a boat, and that's a whole other story. But what I don't want to do is spend whatever time I have, you know, hooked up to a bag of poison or being burned or cut or anything like that, unless there's absolutely no other alternative. So the difference between a traditional approach and an integrative or non-traditional approach, at least from my point of view, was that I would look at all of those modalities as a last resort, not as a first resort. So I called Anthem and I told her what had happened with my primary care physician, that I did not want to go back to my primary care physician, that I did not want to go back to the oncologist that had been recommended, and that I had recently moved to this area. My insurance was a new insurance program. I had no idea who these people were. I had an HMO. All I knew was a bunch of names. And she offered to help me go through the list, and there were a lot of people. And she said, well, we can call the offices, and, you know, we can talk to them, and you can call some, and I can call some. And I thought that that was incredibly kind and compassionate of her to offer to do that. But it turned out not to be necessary. So when I was talking to my friend and said to her, well, if you want to help, you can, excuse me, I gotta get a pillow. I said, if you want to help, see if you can find an integrative oncologist. And I pointed her in a certain direction, and the direction that I pointed her was, I just happened to have been watching PBS. Again, you know, the miracle of a connected universe. You know, nothing is coincidental. Well, anyway, that's a whole other discussion. Before I had been diagnosed, before the lump even came out, I had been watching PBS one day or flipping through channels, and I had seen this woman, a doctor by the name of Mimi Guarneri, who happened to be in the same Southern California area that was not too far from me, and that she had been a very traditionally trained and traditionally practiced cardiologist. And then, in her story, if you're interested, you can look up Dr. Mimi Guarneri. She's got books, and now she doesn't practice anymore. She does workshops and lectures and things like that. But she had been an extremely traditional cardiologist where, if there's an ill, there's a pill. If in doubt, cut it out. Those kinds of attitudes towards taking care of disease was, as she said in her PBS program, she would look at people who would come in, and being a cardiologist, they came in with heart problems. She would look at them as a tree with a diseased limb. You cut the tree limb off, and then you hope that the tree recovers, etc. Now, she said, after having been, I forget who she met, but she met one of these people who did things in a different way, and it sort of changed her whole life. And now she looks at people when they come in, and she says, well, if the tree is diseased, let's look at the roots. What's the soil? What are we feeding, et cetera, et cetera. So I said to my friend, I have no idea how to find an integrative oncologist. Why don't you call, if you want to help me, call Mimi Guarneri's office and see if they're taking patients. I don't think they are, but perhaps they are. So she did that, and they said, no, we don't treat patients anymore. But she mentioned a doctor by the name of Dr. Sinclair, and she said, I think he may be an integrative type. It wasn't, I don't know who they talked to at her office. It might not have been Dr. Guarneri, but whoever it was that my friend talked to said, you can try this guy. He's at Scripps Cancer Center in La Jolla, and he has a reputation of being somewhat of an integrative type. And I thought, okay. So when I was talking to my Anthem Blue Cross person, I said, well, before you go through checking every random person, here's this guy, Dr. Sinclair, that we know at least is in the geographical area and is supposedly integrative. Can you find out if he's in my network? Because now that I have an HMO, I can't just go see anybody. And again, through the miracle of the universe, it turned out that not only was he an integrative oncologist, he was also in my network and accepting new patients. And the reason I decided to go see him was that my friend sent me all of the information that she had gathered on him, and he had a YouTube video dating back to 2011 in which he was the only actual doctor oncologist who went to this conference of kind of alternative cancer treatments or alternative treatments, and he spoke about how he had been trained very traditionally. He'd only had, the 1 hour of nutrition advice and things like that, and that he had been a very traditional oncologist until he started realizing that all of these wonderful things that he would read about in the literature that was funded obviously by the drug companies weren't turning out that way when he was at the patient's bedside. And especially with an older patient, instead of seeing all these miraculous things that these drugs were supposed to do, he was seeing these incredibly devastating effects. and no real research being done on how to avoid that. So rather than trying to explain what he said, I'm going to see if I can link to his YouTube. I did ask his permission if I could mention his name, and he said fine. So, but the thing that's important was, not saying whether you should go see this particular person, but the things that were so different in his approach was that, as he said in his YouTube video, that he learned that he needed to listen to his patients, treat them as individuals, and listen kind of mindfully to understand what it was that he could offer them to help them accomplish what they wanted to accomplish. And so I had Anthem, the nice Anthem lady, whose name now I can't remember. I would want to give her a shout out, but I can't remember her name. Anyway, I had the Anthem lady call the office and make an appointment for me. So when I went to my first appointment, I was still really nervous. I knew that, okay, this guy is going to at least listen, and if I say I want to try these cleanses and the detoxes, he's probably going to say fine, but he's also probably going to say, okay, you don't need to do the chemo or the radiation or the hormones, but hey, you still have a big lump on your breast, and you're probably going to need to have surgery. So I went to see him. I think my first appointment, let's see, July, June, May, April, I think it was April? I can't remember anymore. Anyway, at my first appointment, I went in, and the wonderful thing, I mean, the whole vibe in his office was totally different from the vibes in all the other people's office. The people were all relaxed, they were all friendly, everybody was very professional, but I didn't get the feeling that they were all kind of stressed. And we sat down, and I had actually sent him something like a 7-page chronology explaining everything that I had done from the minute, the lump had come out until now, the detoxes, the cleanses, etc., the fact that I was now jogging. I think I sent him a video of me jogging on the beach for my 74th birthday, and I wrote him a long chronology, and amazingly enough, he read it. And when I went to see him, we sat and we talked, and I told him a little bit of my story, and then he examined my breast, which still had a lump in it, and I was astounded when he said, well, I don't know this program that you're on, but whatever you're doing, it seems to be working. So why don't you keep it up and come back in 3 months? And I was like, you mean you're not going to tell me that I absolutely positively have to have surgery immediately? And he said, no. He says, I want you to keep doing what you're doing. You can't slack off. But I see no need for medical intervention at this time. And when he said that, I literally leaped up, and I gave him the, I think he said, he looked at me and said, what, are you going to hug me or something? I said, yes, can I hug you? And he says, sure. And he gave me a hug, and he said, just, we need to take some blood work. We will need to do another ultrasound, etc. But it was incredible. I mean, the feeling of being able to be in a medical doctor's office who could order the blood work. So, he could test your tumor markers. He could test, your vitamin D levels, all of the things that, you can't really do just doing this on your own. And the fact that I could then go and talk to my family and my friends and say, okay, look, I've been to an oncologist. I'm going to be following, you know, he's going to be following what I'm doing. I'm not just flying blind, was this huge relief. It took so much pressure off of me that, I mean, it was incredible. And when I went back to see him in July, we're October now, and I have another appointment at the end of October, and I will have another breast ultrasound before I go see him. But when I went back to see him in July, because he had said, okay, come back in 3 months, again, he was very supportive, and I was worried because, again, I felt great, but I still have a lump in my breast. And so I was so nervous, again, when I went to see him, because I thought he was going to say, okay, well, you know, you've tried this for 3 months now, and you still have a lump in your breast. I was so nervous that my fingers were so cold, they couldn't take those little things that they put on to test the oxygen level. The woman says, "Are you feeling faint?" I said, "No." She said, "Well, your hands are freezing. I can't get a reading." I said, "Well, I'm anxious." And he came into the room then and said something or the other, and I said, he said, "How are you doing?" And I'm happy to see you or something. And I said, "Well, I'm happy to see you too, but I'm also really nervous." And he said, "Don't be nervous. That's not good for you. Stress is not good for you. Why are you nervous?" And I said, "Well, I'm nervous because I feel great and I'm doing all these things. I sent you the video of me doing an hour on the treadmill and eating, you know, raw, organic, vegan, gluten-free, you know, etc. But I still have a lump in my breast." And he was just amazing. He said, "Well, you know, it's going to take a while. If you do it the way you're doing it, you have to understand that this is a long-term commitment, and the lump could be gone in 6 months or a year or 2 years or however many years. Don't look at that. Look at what the what vector, what direction are you going in?" And then he took more blood tests, and all the blood tests came back really good. He says your tumor markers are where they need to be, and I was supposed to have had another ultrasound, but there'd been some scheduling snafu, and so I hadn't been able to have the ultrasound before going in to see him. And I said, "Well, do I have to come back?" And he said, "You know what? Keep doing what you're doing. I'll see you on October 30th, and you can have the ultrasound right before you come back." And so it was just, you know, and he looked at me, he says, "Daniela," he said, "you know, we're partners. You know, I don't want you to be nervous or stressed when you come to see me. We're partners in this." So I'm going to try and link to his YouTube video, but the important thing is to understand that if you don't want to go completely on your own, you know, which is very stressful. I mean, it's every time something happens, it's like, "Oh, well, I don't know, what does this mean? And should I have a blood test? And oh my God, what if it's spreading?" or whatever. So to know that you have somebody in your corner who has all of the tools that are in the arsenal of a regular traditional doctor, if it comes to that, but who is also willing to treat you as an individual, as a human being, as a specific individual body, not, okay, this is the protocol for a 74-year-old woman, we're going to do this and this and this, and then hope that you get better. It just meant the world to me. It meant the world to me. So I want to make it clear that it's very unlikely that you will get support for any dietary lifestyle or other so-called alternative methods of dealing with cancer from a traditional medical doctor or oncologist. That's not the way they're trained. That's not what the protocol is. And, you know, and they don't make as much money because they're not selling chemo, they're not doing radiation, they're not doing that, they're not making the bucks off of that. But they also are, most of them are not treating you as sort of a partner in the journey. It's like, we know what to do, this is what you have to do if you want to do this treatment. So to find a doctor who has all of the bona fides of the medical school and the experience and the years of working with cancer patients, but who has also had their eyes and ears open to the individual journey that each cancer patient has to take, and who understands that diet and lifestyle and exercise and stress and all of those things are huge factors in health. It's just a gift to find somebody like that. So there aren't a lot of them, but there are more and more people who are themselves tired of being the traditional medical doctors, and who are opening their minds to the fact that there are complementary and alternative things that do affect health, and that whether you have the traditional therapy and then you're sitting at home eating hamburgers, maybe that's not so healthy, and that if you decide to go the other route, it may take a longer time for sure. But here I am. It's December, January, February, March, April, May, June, July, August, September, October. It's 10 months, and I feel good. I'm a little nervous because I have to have another ultrasound, and yes, I still have a lump in my breast, but considering how large it was when we started, it doesn't feel that bad, and my breast for the last several months has started to just feel like a regular breast again. It doesn't, there's no aching, there's no throbbing, there's no pain, there's no detoxing where, all this detoxing can be a little gnarly when you look at it. So, yes, the Dr. Schultz detox program works. It's simple, but it's not easy. It's simple because it's basically drink right, eat right, exercise, live a healthy life. But it's not easy because it turns out that the life we do lead is not healthy. And that it's amazing that drinking enough water, getting enough exercise, eating organic, raw, fresh food, all of that takes up pretty much most of your day. By the time you're done doing all of that, you don't have a lot of time for most of the stuff that we spend all our time on. And so, to me, it really corroborates the insight that I had in the first few days after my diagnosis, where I kept hearing this voice in my head say, cancer is the symptom, your life is the dis-ease. Heal your life, heal your cancer. So I'm not saying my cancer is healed yet, because it's a journey, it's a process. But I will say that I've had 10 months of good health, and that I feel good. If I can keep going like this, I can keep going like this, knock wood, forever. But it does take, absolutely, it takes a commitment. It's a lifetime commitment. It's simple, it's not so hard. You got to drink enough clean water, you got to eat enough clean food, you got to exercise till you sweat and your body is moving, and you have to stop listening to the news and scrolling endlessly on social media and sitting around like this, being depressed. You got to do the yoga, you got to meditate, you got to be joyful, you got to live a life and be happy with your life, whatever that is. But what else, what else is worth more than that? Maybe you're not going to make $1 million working like a crazy person, but you're going to have a better, healthier, happier life. So if you have cancer and you want to try restoring your health with dietary, lifestyle, and other changes, I absolutely recommend the Dr. Schultz program, or whatever program works for you. For me, the Schultz program is the most rigorous, in the sense of it's not just exercise and diet. It's exercise, diet, lifestyle, mental, emotional, all of it. There's like 20 steps, but it's all about living a good life, and then finding a doctor who is open-minded and who looks at you as a human being, not as, well, this is the ICD breast cancer and, blah, blah, blah. Then find an integrative oncologist. It's not easy, but it is possible. And it just takes some determination. So when you talk to your doctor, ask questions about whether or not they're open to such things. If they're not open, go to another doctor. Now, one more thing. One of the websites that was very helpful to me in the beginning is the website Chris Beat Cancer. And on Chris Beat Cancer, he's a guy who beat cancer and has a website. Now he travels all over the world and talks with people who are trying to do it naturally. And he has a teaching modules. I think they're 10 or 12 modules, and they're quite helpful. The first module, which I found really eye-opening and helpful, is 20 questions to ask your oncologist. And so don't be afraid to talk to your doctor. Don't be afraid to ask questions. Don't be afraid to say, this is what I want to see in my own. This is how I envision my life. What can you do to help me get to there? As opposed to just, okay, you're the doctor and I'm the patient. I know nothing, you know everything. Because nobody knows your body like you do. Nobody knows really why you got the dis-ease. The person with the cancer pretty much knows. I knew as soon as I was diagnosed, I know how I got here. And I know what I need to do to change. But to be able to have the support of someone in the medical community, and also the support of people like the Dr. Schultz people. Their website is herbdoc.com, and they have amazing people answering the phone who, they won't give you medical advice, but if you want to try their detoxes and programs, they know those programs really well. And they can explain, this is this program and this is that program and this is what you have to do, etc. And again, they're simple, but they're not easy. They will kick your ass, because it turns out that living a healthy life is actually a full-time job. So enjoy. I hope there's something in here that is helpful for you if you are starting your journey. I know what it feels like to be terrified. I know what it feels like to be in shock at a diagnosis and to think, oh my God, what do I do? What do I do? And I also know what it feels like to have one of the greatest fears, which is that, oh my God, the medical establishment is going to somehow push me to do this, and how can I find somebody who will support me? But also, if what I'm doing doesn't work, then if they've supported me through this, then I'm going to trust them. For example, if my doctor said to me now, okay, you've tried everything, it's not working, now you have to consider something else, I would trust him because I know that he's been with me on this journey. So good luck, and enjoy the journey. Enjoy the adventure.